As a teenager, Erica Maud suffered from painful scoliosis, but rather than go under the knife, she treated herself with exercise.
Yes, she's now opened her own clinic to treat others with a debilitating condition. We can see the results of one patient going from this to this. What a transformation.
Well, I chose not to take surgery because obviously it's very risky. It can even be life-threatening, and I didn't want to take that risk.
What difference has it made, this treatment?
The key thing about this treatment is it has zapped entirely my pain. For me, I was never as bad as Erica. My big issue was pain, which kind of kicks in when you're older. When I was 27, I started to get chronic pain, and I had it for about 7 years.
Okay guys, we're going to start with some theory, so if you want to grab yourself something to sit on, we'll get in a little circle.
This is the Scoliosis SOS Centre. It's the only clinic of its kind in the UK and uses exercise and physiotherapy to try to improve posture. There are up to 20 people on each course, and they'll exercise for 6 hours a day for the next 4 weeks.
Okay, so just nice and relaxed, Priya. Let your arms relax, let your head relax. That's it. It might take a little bit.
At the start of the course, all patients are assessed to measure the amount of curve and rotation in the spine.
And push this hip down as well. This is your fifth pelvis correction.
Freya from Essex is 12 years old. Recently, she was diagnosed with scoliosis.
I noticed that there seemed to be a curvature of her spine, and then I took her to see her GP, who confirmed that she did have curvature of the spine.
The spine curves to the side, and there's also rotation of the rib cage as well. So you end up with a hump on one side and a concaved area on the other side, which is obviously very disfiguring, particularly for young teenage girls.
At the moment, Freya's curve is slight, but nobody knows how it will develop. So her mum is taking her for controversial treatment. She hopes it will help Freya avoid major surgery.
I think I would only consider surgery if it was a life or death situation.
Zoe has lived with scoliosis for 25 years. She's hoping the course will relieve some of the pain caused by her curved spine.
And then breathe out.
Zoe is getting extra help. The clinic uses one-to-one sessions for specific problems and support.
Finding a way to stretch the muscles and strengthen the muscles, to me it seems perfectly logical. It certainly seems to be making a difference already.
The patients learn a completely different posture of alignment, so they're holding the body in a different way, and their muscles are being re-educated to hold the body in that posture. If you imagine the spine as like a tent pole, if it didn't have any muscles around it, it would fall over. So it needs the muscles surrounding the spine to hold it up, and if the muscles are working incorrectly, then if you imagine that the tent pole is going to lean over to one side, which is what happens.
Aisha Jones is just 17. Her backbone was so contorted that her ribs were squashing her lungs, making it difficult for her to breathe.
In, push against my hand, open.
Hospital specialists said her only option was a major operation to straighten her spine, but the risk of paralysis drove her to seek an alternative.
I feel straighter, I've got more lung capacity, I can breathe better, I feel more confident with my body. I don't feel as though my clothes, because when I used to wear clothes, I used to poke out here and there, but I feel like they fit me a lot better.
We can reduce the amount of pain, we can improve the quality of life, we can improve the posture, what is very, very important for patients.
Before and after photographs speak for themselves. Since childhood, Carol Davies has lived with scoliosis. As she's got older, the pain's got worse.
I've stopped playing squash, which I did for a long time, which was really too painful. We keep sheep at home. We have a small sheep farm. Handling the sheep was getting quite painful and tiring.
She's never wanted corrective surgery. Instead, she's opted for an intensive 4-week course of treatment. Everyone on the course did feel they'd leave better equipped to control a potentially debilitating condition.
It's the last day of the course. Today they get their before and after photos. Has it made a difference?
She's got very good before and after photographs, so I think she was very, very pleased with that.
I'd been collapsing over the last, I don't know, maybe 10 years, slowly collapsing. And now I've learnt how to build up muscles that hold me up again. It's really nice. So I feel straighter and I clearly look straighter too.